Hi, welcome to today's Facebook Live Q&A with the Children's Miracle Network Hospitals. I'm Alex Tercey with the University of Vermont Health Network, based in Vermont and Northern New York. COVID-19 has placed an unprecedented stress on the United States health system. Hospitals are adapting to new priorities in order to manage the massive scope and impact of the pandemic. The strain on hospitals is well documented, and this is also true of children's hospitals, who are urgently responding to the pandemic. High quality, life-saving care that children need every day. We're here today to talk to Dr. Lewis First. He's the Chief of Pediatrics at the University of Vermont Children's Hospital. We're going to talk to him about their response to the pandemic and learn more about COVID-19 and share some tips with you as well. If you do have a question for Dr. First, leave it as a comment and we'll answer it on the air. Dr. First, nice to see you today.
Alex, good afternoon. And I want to say good afternoon to so many of you who are taking a few minutes out to celebrate your children's hospital and to link in through Facebook to the Children's Miracle Network. Our hospital has been a partner with the Children's Miracle Network since before I got here, which was 26 plus years ago, back in the 1980s. And I can tell you that it has been a lifeline for our children's hospital and for the 169 other children's hospitals that really need a organization like the Children's Hospital, its community partners, and needs every one of you to basically virtually hug in this COVID time period, put a giant hug around the children's hospitals. The Children's Miracle Network helps us support. With Thanksgiving here, I'm going to just start with a giant thank you to everyone who has been a part of the network, and certainly a special thank you and lots of gratitude to the children and families who have been served by children's hospitals, but are now giving back as well by supporting the Children's Miracle Network. So it is an honor and a privilege to be here and to talk a little bit about COVID.
Well said. Thank you, Dr. First. Well, perhaps we could start by just learning a little bit about you. What's your role at the Children's Hospital? Tell us a little bit more.
Let me just tell you, I have been the chief of the University of Vermont Children's Hospital for the past 26 plus years, and I'm just getting started. And I've also been chair of the Department of Pediatrics at the University of Vermont Larner College of Medicine. But I think it's more important as people watch this Facebook Live, I'm first of all a general pediatrician, which means I know a little bit about kids. My background is emergency pediatrics, primary care pediatrics, and now I'm what's called a hospitalist, which means I help to take care of the children who need our inpatient services at the University of Vermont Children's Hospital. So in that sense, it allows me to stay with acute care, chronic care, outpatient care, inpatient care, and keep my finger on the pulse of what's happening here in Vermont, as I'm sure chiefs of hospitals, children's hospitals do all over the country. But I'm also a dad and a grandfather, and I have needed our children's hospital as a parent and a grandparent on more occasions than I can even begin to use this Facebook Live for. So I'm not just someone who oversees the quality of services here, and it's a team effort, but I'm somebody who also has needed it and has needed it literally to save the life of my granddaughter, who would not be here today if it were not for the fact that we have a state-of-the-art children's hospital made possible as well through some of the things the Children's Miracle Network has provided.
Wow. And what are you most proud of as you look back on those 26 years? What are you most proud of about the University of Vermont Children's Hospital?
I am proud about the fact, I'm proud about the team and the culture of teamwork and collaboration. I know that sounds corny, but this is a place where we just join hands around. We can't do that now with COVID here, but we virtually join hands to make a difference in the lives of children and families, which is the mission of CMN, but it's also the mission of every children's hospital. And so what we've been able to create and what we've been able to do using science, using evidence, using quality improvement, and listening to what our families tell us they need this children's hospital to be, is what I am proud of. Stuff when I tell people it's not my children's hospital, it's our children's hospital. And that would not be possible without the teamwork and collaboration that has kept me here for 26 years and has me just as energized each and every day to make a difference. In fact, I don't think there has been a day I've been here where we don't finish the day without making sure that many children are in a better spot because of the equipment, the services, the programs that we've been able to put together, both with people and with the support of CMN, Children's Miracle Network. That's so why wonderful. It's a team effort, and I am so proud to be a part of it.
Well, speaking of the team, Let's talk about COVID-19. As we said earlier in the intro, unprecedented times and an unprecedented response from Children's Hospital teams. How is the UVM Children's Hospital responding, and how have they been affected by COVID-19?
So, Alex, who hasn't been affected by
True.
COVID-19? This is something that affects all of us. It's not
Mhm.
just about children, it affects all
Yeah.
of us. And so from a standpoint of providing care to children and families, it one could say it's been the most challenging year of my 40-year semi career in pediatrics, but it's also been the most inspiring and the most resilient because of how we've done this. Here in Vermont, we have really, again, team and collaboration come together, and we have been able to transform our programs, but to meet the demands of what this pandemic is asking us to do. And so we have changed a number of things. But one thing we haven't changed is to make sure that we are providing the highest quality, child-friendly, family-centered care possible. So
Mhm.
how do you do that in the midst of a pandemic? And when I see it happening, that we can put smiles on the faces of children at the same time they're isolated, at the same time they are having their lives turned upside down where they can't see their grandparents, they can't have the visitors that we normally love to have, they can't go to a playroom. And yet we've been able to pull this off by bringing the playrooms into the rooms, by making sure through equipment technology we have the grandparents right there,
Mhm.
and that we've been able not only to keep our kids safe during the pandemic, whether they're inpatient or outpatient and healing, but we've also kept our staff safe. And so as I knock on my desk here,
Mhm.
it's
Mhm.
remarkable that here we are 6 to 7 months along, and our staff has remained incredibly healthy and safe while we've taken care of many, many children who have needed our services at our children's hospital.
Good to hear. If you're just tuning in, we're talking with Dr. Lewis First. He's the Chief of Pediatrics at the University of Vermont Children's Hospital, and we're talking about COVID-19 and more. If you do have a question, post it as a comment. We do have one question that came in from Blaise. He's wondering, why aren't we putting more focus on the elderly, the ones who seem to be dying more disproportionately from COVID-19? So I wondered, maybe Dr. First, you could speak a little bit about how kids are affected by COVID-19 versus adults, and what we know
So,
perhaps about
so
how
the
different
question is,
groups
why
are.
aren't we putting, was the question, why aren't we putting more emphasis on the elderly? Is that what you're,
Yes, yes, that's the question from Blaise.
COVID-19 affects all of us. The
Mhm,
problem is as we age, and the question is a really good one, um,
mhm,
people's ability to fight off germs and infection become they're worn out, meaning they've used up a lot of their defense systems. And so when we hear about the elderly succumbing to this virus, it breaks my heart. It breaks all of our hearts. But when
mhm,
I say it affects all of us, if we don't start with the people who say, it can't get me, I'm not going to get that sick, then we will have a problem with our elderly. This is a team effort. We are in this together. So when we
mhm,
talk about dealing with COVID-19, if we're going to help the elderly, we start with the children, the young adults, the teenagers, the adults who feel, oh, this is going to be like a bad cold, but
mhm,
it's not. And even across the country, we now have seen 10% of the people who are getting COVID-19 and testing positive are children. And
mhm,
we know that children carry this illness. They may not be as affected, but they can spread it. The good news is that they spread it and can spread it only if they don't take the same precautions that we want adults and the elderly to take.
mhm,
So this is one where it's like that game whack-a-mole, where you can't take, you can't just knock down one and say we took care of kids and we didn't take care of the elderly. If we don't all do the same thing I started this Facebook Live with, join arms virtually and think about teamwork and collaboration and doing the right thing that science dictates, then the question is right. We are going to continue to lose people, but we're losing young adults. And in children's hospitals around the country, sadly, we have also lost children from
mhm,
this illness. Now, less frequently than we're seeing with adults, and maybe their immune systems are stronger. That's what we're trying to study. But it doesn't mean that we take our foot off the gas pedal and not do for everyone the same precautions, the same care, the same,
mhm,
not, it's not going to get me, but I have to be part of the solution. We have to be part of the solution. And if we do that, then we won't have to talk about the elderly who really need us to become heroes, help them get through this pandemic, certainly
mhm,
until we have the vaccines available.
mhm. Sure. Have any kids been treated for COVID-19 at the UVM Children's Hospital?
We have had probably about 14% of the kids who've tested positive in Vermont at this point, a little higher than the national level, have tested positive. But the beauty of what we do is that we've had some kids come in and we thought might be COVID. We're not,
Mhm.
we've had many children hospitalized. To have a child hospitalized at our children's hospital with COVID, meaning we can help to keep the spread and the symptoms as mild as we possibly can. So how do we do that? We basically make sure that the care we provide is safe, timely, efficient,
Mhm.
effective, equitable, and patient-centered.
Mhm.
And when we do that, we can start to catch early on the first symptoms of COVID. We can keep kids hydrated. We can give them instructions about preventing the spread, and we can follow these kids carefully. We are staffed to take care of the sickest children, hopefully we will not see.
Mhm.
And our children's hospital has many, many changes in order to accommodate these children safely, efficiently, effectively, equitably, etc. But we could not do that without the equipment and the services that CMN provides, and with a team of people who are relentlessly positive about doing the right thing. So in
Mhm.
our hospital, masks all the time, hand washing all the time, physical distancing all the time. We don't even eat in the same rooms together anymore to prevent
Mhm.
even taking those masks off, because it's your child, it's your grandchild,
Mhm.
it's your neighbor's child that we don't want to see come into our intensive care unit. If we do, we're ready because of the equipment that we have here. But in the meantime, the goal is to keep kids healthy. So we are also, as a children's hospital, out in the schools. We're making school sports safe. If we can keep the numbers of kids down from getting COVID, or keep it mild or asymptomatic,
Mhm.
then we won't need to have these children coming into the hospital, but we still need to protect each other from getting this illness. Usually when we see kids getting it, it means that the adults have usually spread it to children.
Okay.
Okay. And they do it more frequently than children necessarily spreading it to adults, which is why, if you think about it, and I'm sorry I get so passionate about this, during this
Mhm.
whole pandemic, childcare centers have been open. And
Mhm.
you never hear about the kids in childcare who are doing fine. Precautions are being taken, but the
Mhm.
smallest children are not getting COVID. So let's learn from that. Same thing about
Mhm.
schools. Not having children in schools, again, requires a couple things to be happening. If the prevalence of this virus is exceedingly high, meaning probably close to 7 to 10%, then you have to reassess whether schools should be open, but you don't want to get there. Number two, you want to be able to test and trace.
Mhm.
If you can't test and trace, then you're going to run some risks about moving kids into large open spaces, even schools. And then finally, you need to have protocols in place at schools. And again, our children's hospital has partnered with the Agency of Education, with
Mhm.
schools, with teachers, with students, with our American Academy of Pediatrics, and with other hospitals and practices all over the state to set up policies for schools. And thus far, the number of cases of COVID that are occurring in schools in our state, exceedingly low. And we're keeping kids in school, which brings equity to the system, because there are many children who could not, staying at home, are not going to get the services and the learning and the supports that they could get if we can keep them in school. So when you say,
Mhm.
how are we doing? We've got our kids in school. We've got kids not in the hospital. We've got everybody taking the proper precautions. Why? Because it's not, I'm the doctor and you're not. It's because I'm a parent and so are you. I'm a member of the community. Let's do the right thing. Sorry, I
Mhm.
got so passionate there, Alex, but I think it's really important for people to understand that the science tells us how to do this. And when we do it, our outcome results are good. So even though we may have a positive test in a child, they're not getting very sick and they're not spreading it. And that's going to keep the numbers down for our adults and our elderly.
Mhm. Wonderful. And no problem with passion. I think this is something we need to be passionate about. So no apology necessary. We had a few questions trickle in, so I just want to make time to ask them of you, Doctor,
Sure.
first. First off, Kristen is wondering, what's one myth around COVID that you wish to dispel?
Well, first of all, there are a number of myths around
Hmm.
COVID that you wish to dispel. So first, that children can't get it, or that young people can't get sick from it. Not
Hmm.
true. Likewise, elderly can survive with it.
Mm.
Okay. Not that all people who are elderly are going to get it, but they're in an age bracket where we know as we get older, our bodies wear out. So
Hmm.
let's start there. Number two, that wearing a mask is going to affect your ability to breathe or is going to make things worse. Not true. And then most importantly, really using and watching the results on these vaccines and understanding that the
Mm,
vaccines are designed to get us through this, out of it, and back to allowing our kids, our grown-ups, adults to be with each other and to really celebrate families and communities in the ways we were doing it a year ago before this all started. So the myth busting is just to understand that not wearing a mask, okay, is exactly, that's a myth, that you're
mhm.
going to be fine if you don't wear your mask.
Okay. Okay. Another question we have is from Amanda. She asks, how should we handle things that come home from school? Lunch boxes, backpacks, coats, wipe down, wash them. Like
Yes,
what should we do with them?
I mean, you can't be too cautious. So it's a good idea from they come in to use disinfectant and to let things sit for an hour after you clean them off and get them ready for the next day. It's important to change your masks each day and
Mm,
not just and wash them if you're using a two-ply cloth mask. You can't be too careful and just assume. By letting something sit, it's true that the virus will die over a period of hours, but it's on surfaces and it can come home. And so you just want to be able to have a set of clean clothes, perhaps for your kids to get into when they come out of school. But those clothes, get them washed. I can't prove to you that you can catch COVID from various surfaces, but we do know that it can settle, and that, again, washing down surfaces with a disinfectant is certainly going to not hurt the situation.
mhm, mhm. Yeah, can never be too careful, I suppose.
No,
So err on the
no.
side of caution. Well, if you're just tuning in, we're talking to Dr. Lewis first. He's the chief of pediatrics at the University of Vermont Children's Hospital, and he's answering our questions and your questions about COVID-19. So if you do have a question, please post as a comment. We'd love to ask it of him on the air. Thanksgiving is this Thursday, Dr. First. Lots of questions about that going around on social media, and I'm sure families are making some hard decisions around Thanksgiving. So we do have one question from Brooke, who asks, should we all avoid going to other households for Thanksgiving?
Brooke, it breaks my heart to give you the answer that you don't want me to give you. But the
Mhm,
answer is yes. 1 year. Okay, this is a marathon. This is not a sprint. Okay, there are so many ways to reach out now through technology to celebrate Thanksgiving without putting someone at risk. It's sort of like you can win a battle and lose a war by bringing family together at this time of year. You don't know who they've been with. You don't know if they're
mhm,
harboring the germ. We do know that a lot of spread seems to occur when the masks come off and you're eating. So if you're going to want to celebrate Thanksgiving, I can give you lots of ideas. Having everybody in your network prepare a dish and share it with each other and leave it in front of each person's house. If you live in a climate where you can celebrate Thanksgiving outside, then do it as a picnic. Okay, and sit 6 feet apart and wear your mask as much as possible. If you're going to be in a home setting, then theoretically, again, people should, if you have guests in the home, masks should be worn until you sit. Try and keep people at least 6 feet away, and give thanks for the fact that you're healthy and give thanks for the fact that you want to keep people healthy. What we don't want to see, if 2 weeks from now, 10 days to 2 weeks, there is an outpouring of positive COVID cases that are sick, that are having the breathing problems and need our hospitals, our children's hospitals, our adult hospitals, and it all happens at once, we're going to have a
mhm,
problem in terms of capacity, which is also to say, you almost don't even think about Thanksgiving. Everybody should have a flu shot as well at this time of year. Before we have the vaccine for COVID available, please, please, please immunize to flu, because sometimes you can't tell the difference.
mm,
And every bed in a children's hospital is valuable right now. Every bed needs to be there for that child who needs that children's hospital. And if it's a preventable illness that we could have immunized, vaccinated to, and prevented by following instructions, then that means that child who does need that intensive care unit or who does need that bed in the pediatric floor is going to get it, not because we put other people there where we could have prevented it. So for
mhm,
Thanksgiving, do a virtual Thanksgiving, have everybody through Zoom or any other platform share what they're thankful for. Everybody sit together. Everybody can still enjoy what this means and give thanks that we're helping to keep this planet healthier by not bringing everybody together for a social encounter that could have significant ramifications up the road in a matter of days. If we had that vaccine here, I'd be giving you different information, but it's not here yet. It's coming soon. So please give thanks that we can stay healthy, and don't have the family Thanksgiving that we've had before. I know I'm not going to be everybody's favorite, but I would much rather talk to you through Facebook Live than if we do, than see you in our children's hospital. But if we do, we will do everything we can to improve the health and well-being of your child. And I speak for all the children's hospitals in saying that.
You mentioned the vaccine, and we did have a question come in from Jenna, who wondered, do you know when the vaccine will be okay to use on
Children, yeah.
children, especially medically fragile children? Any thoughts on that? Yeah.
So the first thing we can do, remember, as we immunize adults, they're going to be spreading this virus less, which means kids are going to get it less until the vaccines are ready for children. In the same way I talked about our children's hospital being safe, care being efficient, effective, equitable, and child friendly and family centered, that vaccine needs to be safe for children as well. We know, and we're seeing some incredibly positive results on the adult tests on vaccines. We know that one of the vaccine companies has started to test all the way down to age 12. And they are specifically looking for children who have complex medical needs, or children with special health care needs as part of the testing that's going on, which is voluntary. There is a push from the American Academy of Pediatrics to get the testing going yesterday for children, so that we can hopefully, the hope is to have this vaccine available by this summer. But I will be surprised if we have it any sooner than that, or late spring for kids. We will certainly have it for adults. And in doing that, it's going to drop the numbers pretty quickly, we hope, if people take the vaccine or the vaccines, and there are several of them to choose from right now. And then the kids will follow, and then we will get through this. So the good news is there will be vaccines for children. The vaccines and the tests that are coming out in phase 3 trials are looking exceedingly promising. A third one came out this week. And I know there was another CMN Facebook Live where vaccines were all discussed last week. And I'm happy to answer some questions. I'm not an infectious disease specialist, but I certainly know the value of building up antibodies without getting the real virus. And that's what a vaccine can do. And that's how it can prevent flu from getting in, and some of the other life-threatening illnesses in children have been eradicated because of vaccines. So if we can get the adults down, that's called herd immunity. If your community get enough people who are saying, stay away, COVID, stay away, SARS-CoV-2, which is the virus, then kids will be less apt to get this, and we'll get everybody back in school, everybody back on their school sports teams. And the goal here is to get those spring sports going, if not, at least the outdoor winter sports, as best we can as we start to bring this vaccine into play.
Great. Thanks for sharing that. Another question from Melissa, who asks, what is the best way to ensure the safety of children with special needs during COVID-19?
The best way is to, first of all, this is to talk to your child's medical home, meaning their pediatrician, their teachers, the support services. There are some children who benefit greatly with special health needs from being in a school environment, assuming that the prevalence of the disease allows that to happen. If not, then the best thing you can do is, again, keep your child who has special health care needs isolated from others who they don't know. Keep them out of crowds, wash hands, disinfect surfaces, and wear the mask. If a child will not wear a mask because of special health needs, then again, in going out, do everything you can to have other people wear their mask around your child. We are not seeing an uptick in, certainly if you have other reasons to be sick, if your immune system is suppressed because you have cancer, then you really need to protect your immune system and hopefully not get another infection, whether it's COVID or something else. But if we take those precautions, our goal is to, again, equity, to make sure that any child is as protected as any other child, regardless of their underlying medical needs. But that takes team effort, cooperation, and making sure and telling your friends they need to wear that mask around your child. Wash your hands, watch your distance, and see if they can get and say hi to your child through Facebook or Zoom live, then do it in person.
Okay, great. Thank you. Hope that answers your question, Melissa. Another question from Marilyn. This is an interesting one, so I'll be interested to hear what you have to say, Dr. Frisch. Marilyn asks, how do the doctors and nurses keep their spirits up during this pandemic?
Oh, it's a great question. And one of the things I focus on is wellness of our families and wellness of each other. One of the things we do at our children's hospital is we've divided our doctors and nurses who want to do this, and a good number do, into houses like Harry Potter. So
Hmm.
I oversee a house called First Indoor. And every
Oh.
month we put up a series of tasks that are actually, they're not tasks, they're like go out and celebrate the leaves. Um, Call someone on FaceTime that you haven't and take a selfie of what you're doing. Carve a pumpkin. And we take these pictures, and at our morning conferences, we show these pictures. Last month, which was a very tough month, just as we watched the virus pick up, my doctors and nurses came in with 150 photos of smiles on their faces, doing things in the community, helping to make their children in their own home smile, pictures with pets, pictures of being creative with masks. So we find ways to do that. And we talk with our patients. One of the greatest things I can do is spend time each and every day on our children's hospital celebrating with our kids that we can put smiles on their faces. And the toys, the games, the child life programs would not be here without Children's Miracle Network. But I knew I was going to do a here's a great example, Alex. I knew I was going to do a Facebook Live. So I turned to the kids up on our children's hospital and I said, what should I tell everybody who's watching today? And they said, well, you got to tell them some COVID-19 riddles. I said, COVID-19 riddles. I mean, this is such a serious, you watch me for 20 minutes talk about how important it is to do this right thing, use science and all, teamwork, collaboration. They said, no, you got to tell them. So here's one that this is an adolescent told me on the floor. If a lot of people have babies this year, what will they call their children in the 2030s? Wait
I'm
for
not
it. You
sure.
ready?
I'm
Ready?
waiting.
Quarantines.
Oh.
Quarantines. All right.
Very cute.
Then another little boy said, Dr. First, you know why you don't hear a lot of funny things about quarantining? And I said, no, I don't know why you shouldn't hear a lot of funny things about quarantine. He says, no, Dr. First, that's because they're all inside jokes. Then a little girl who's a little bit better, she said to me, she said, Dr. First, where do sick boats go during the pandemic? And I said, I don't know. Where do sick boats go? And she went, to the dock. And then it just erupted. Why did the clown go to the doctor during the pandemic?
I'm not sure.
Because it was feeling kind of funny. Anyway, we do this all the time. And it's just
adorable.
when we have these I know it's like mom and dad humor, but when a child tells you that, it just makes you all the more focused on wanting to get that child to keep smiling and get them out of our hospital and get them back to the friends and family that they love so much. And that's what this is all about.
That's wonderful. And children are often unwittingly show us how to be resilient during difficult times. Things
They
like
I mean, every challenge should be an opportunity. Every challenge, for example, telehealth. What we can now do, just as we're doing here, to be able to check on our families through telehealth setups. Again, Children's Miracle Network, I'm sure around the country, has helped to make this possible. But we can check on our children with special health care needs who may be scared to come into the hospital, but now we can see them and we can make sure their equipment is working, and we can do it all with telehealth. Our teenage patients tell us that they would much rather talk to us privately from their own rooms in their homes than come into our offices. So we're going to be there. I think this is going to change medicine for the better, where we can bring the healthcare to you. We can bring our children's hospital to you, okay, without dropping a beat. Yes, we still need to see you to give those vaccinations. But that takes support of everybody, both cooperating with a care plan, but also making sure that children's hospitals have been, are, and will always be here. And that's become a little tougher during the pandemic, as you can imagine, from a fundraising standpoint.
Yeah, I would imagine. Well, we're coming up on 2 p.m.
Oh my goodness.
So
Well, let me,
Sure, we could keep going, but I wanted to ask you, Dr. First, do you have final message that you would like to
well, a
share
couple things.
with the
I just
viewers?
mentioned, yeah, a couple things, Alex, and thank you for the time today. First of all, I just want to say, well, fundraising with Children's Miracle Network is really friend raising, and
Mhm,
it's an investment in the future. And while you might say right now it's constrained, we have such great community partners. And one, I just want to people know we do something here in Vermont called the Big Change Roundup, where every year in the winter, our partner radio station WOKO does this incredible event with us where we ask everyone to collect their spare change, and it adds up to hundreds of thousands of dollars in nickels, dimes, and quarters. What a simple concept. Then the
mhm,
pandemic hit, and WOKO and our children's hospital said, we can't ask people at this time of need to go out and collect this change. So we stopped it. We stopped the
mhm,
fundraising and the friend raising. We were there for our families. And then something really, really incredible happened as the summer went along. All these families contacted us and said, what about all that change we raised? Don't you need it for your children's hospital? And they
mhm,
came, and we didn't count it publicly. They dropped it off at safe drop-offs. And
mhm.
once again, hundreds of thousands of dollars came in when we weren't even running the event
Wow.
to say, this children's hospital, ours, and the one you're in, wherever you are in this country, is a lifeline. And the comment from families was, just because you don't want to, you want to keep us safe, we want to keep your children's hospital safe. So I just got to say, hats off to our radio partner, WOKO, hats off to our community partners that support
Mhm,
Children's Miracle Network, but hats off to the families who
mhm,
understand what a children's hospital is all about. So I'm gonna wrap up with a couple things. One is just remember the 3 W's at this particular time. I always tell people, do you know what the 3 W's are?
I don't. I'm eager to learn.
Number one, wear your mask.
Mm,
Please, W, wear your mask. Number two, wash your hands before doing. Wash your hands. Number three, watch your distance.
mm,
Watch your distance. Okay. And those 3 W's are going to help to improve the health and safety of our community. And we will get through this together. And of course, if you're not feeling ill, kids, don't go out to that event. Don't even go to those events, but just stay home, isolate, and we will get through this together. And then I can leave you with a knock knock joke that one of the kids gave me before I started Facebook Live today. You want it?
mhm, I do. I'm sure our
Knock
community
knock.
do. Who's there?
Wanda and Abby.
Wanda and Abby who?
Want to thank everyone for all they're doing to help us fight off the pandemic and keep our children safe and support our children's hospital. And happy Thanksgiving to everybody.
Indeed, indeed. Thank you so much, Dr. First, for sharing all of this information with us, for answering questions. Thank you, everyone, for tuning in and asking your questions. It helps us all learn. And please share information that you have learned from this today. Happy Thanksgiving to all. And as we go into this season of giving, be thinking about your local children's hospital. And if you're able to support in any way that you can. So thank you for watching and have a wonderful Thanksgiving. Bye.
And please, again, if you can support your children's hospitals, that's great. And I want to thank everybody who's supported ours, and I hope we'll continue to do that. And I give thanks to all of you, to the Children's Miracle Network partners, and most of all, to the children and grandchildren in our lives who make this planet so special and are our future. Here's to you. I give thanks with enormous amount of gratitude. Thanks for allowing me to be a part of this Facebook Live.